He's such a strange and amusing place. One day you buy him rocket ship underpants, and then the next they're in outer space. Mama, don't you know you keep the whole world turning round?
Like most moms, we are so concerned about the H1N1 virus or the swine flu. It's the hottest topic at my kids' school right now. But there's so much conflicting information.
Right, so to straighten out our questions and help alleviate our concerns, we've invited Dr. Nicole Lurie, who is the Assistant Secretary for Preparedness and Response from the Department of Health and Human Services.
Welcome.
Welcome to MommyCast.
Well, thanks. Great to be here.
We've been going around
So
with this. I
many
mean, it
questions.
started last year, but now with this school year coming, I mean, people are really very concerned. And I guess one of the things I wanted to know is, what are exactly the symptoms? Because I think there's a lot of crossover with, you know, colds. And I mean, how do you know that you're headed down the path of the swine flu?
Well, there is a lot of crossover. And the first thing I would say is you know your kids the best. And the symptoms of H1N1 flu are the symptoms of seasonal flu every year. And so that they would include fever or cough or muscle aches or headaches. Those are usually the really common things. Sometimes fatigue, for small kids especially, real irritability. And some people have nausea and vomiting with it.
Okay.
Like, for instance, my youngest child is home from school this morning. He woke up this morning with a slight sore throat and nasal congestion and just not feeling well. I think it's seasonal allergies, but I know that if I had sent him to school and he had said, I don't feel well, they would have sent him home anyway. So we just kept him home. But I guess that's kind of one of the keys to this whole thing is, if your child is not feeling well, err on the side of caution.
Well, first let me say good for you for keeping him home, because, you know, that's really what we need moms and dads to do, is if your kid is sick, stay home and err on the side of caution.
They kind of get mad at you. The schools will get mad at you if you keep your kids home too much. So there's like this balance between, you know, you want to be considerate and careful, but what should we be expecting for this school year? I mean, do you think the schools are going to be more lenient with keeping our kids home, or?
Well, I think all schools are putting their own policies in place. But certainly the guidance that we've developed, and that's on flu.gov if anybody wants to go look, but the guidance suggests that schools really encourage parents to keep kids home when sick. So I would imagine that most schools will be a little bit more liberal about it. Similarly, for kids in high school or even kids in college, you know, if they're sick, they shouldn't try to go to school and take an exam because they're worried about their grade.
Right.
They need to stay home.
Well, how do you know that they're ready to go back? Is it when the fever breaks? How long do you wait until the fever's gone or whatever?
Well, most kids are sick for about 3 to 5 days. And so what you need to do is keep them home for at least 24 hours after they have no fever, off Tylenol or ibuprofen or whatever you're using to keep the fever down. And remember, in that last little bit, kids are going stir crazy and they're wanting to get up and see their friends and go to school, and they need to stay home for at least 24 hours.
No.
So you should plan on 5 to 7 days,
Wow.
which is a long time.
That's a lot.
And you know what? Kids will go stir crazy and parents will go stir crazy.
Oh, yeah.
But if you look on flu.gov, that's what the recommendations are. And as things evolve in this season, and if the situation changes, that's a great place to go for up-to-date information about what to do.
Okay.
See, now I have a question about the vaccine.
Yes.
I called last week at my doctor's office, and I made appointments for my kids to go in and get their
We go to
flu
the same
shots.
pediatrician, too. It's a big one.
And after, you know, making the appointment, I said, you know, this is also going to be for the H1N1 flu shot. And the office said, well, we're not sure we're going to have that shot.
Right.
So now I'm a little confused, because I thought this was kind of the big thing that everybody needed to get this H1N1 shot. Is it going to be available? Is there going to be enough? And who needs to get this shot?
It is going to be available, and there is going to be enough. And we believe that early October will be the time that it will start to become available in your community. And by the end of the month, you should be able to get it pretty easily.
Okay.
You know, it's coming out into communities as fast as the manufacturers can make it.
Right.
And so you ought to be able to tell, hopefully from your school, from your health department, from your doctor's office, where to get it. And it's also likely that a lot of the large chain stores, chain drugstores, will also carry it, and you can go there to get it.
They'll have like
who should get the shot? Everybody, or is there a particular group
Who
of
should
people?
get the shot? Again, all of that's up on flu.gov for people who want to look at it. But it's basically pregnant women, people with chronic disease, children, and particularly early on children with chronic disease.
Okay.
And
So
then
how-
healthcare workers, because healthcare workers or frontline healthcare workers
right.
are exposed to sick people all the time.
Okay.
And remember, for children in general, they can get it either through a nasal spray or a shot.
Okay. For the
But-
H1N1 too,
For H1N1.
as well, I mean.
Yes. Does it matter? Is one more
So what I
better than the
what
other?
I was going to say is if a kid has asthma, or if a mom is pregnant, she should not get the spray.
Okay.
Okay? But otherwise, either the spray
Okay.
or the shot is fine.
So my daughter got sick this summer,
Mhm.
and I guess my question to you is, how are we supposed to take care of these kids? How are we supposed to? Is it different from the way you would treat any other illness?
Well, you would take care of your kid the same way you took care of your kid anytime they were sick,
Right.
particularly if they had something like influenza. And remember, H1N1 symptoms and seasonal influenza symptoms are pretty much the same, and the care is the same. So keep them away from other kids and other people. Keep their fever down. So Tylenol or acetaminophen or Motrin, ibuprofen work great. Don't give a young kid aspirin because
Right.
that can be dangerous. Make sure they have plenty of fluids. Stay in bed. And in that period when they're starting to feel better and want to be up and around, find stuff for them to do so that they don't go infect other people.
True.
At the same time, you want to be on the lookout for warning signs, because one of the things is that some kids can get sick very rapidly. And if that happens, you want to be in touch with your doctor right away. Not to panic, but really to be in touch. And so those kinds of symptoms are particularly if your child is getting short of breath.
Okay.
For small children, particularly if they're so irritable that you can't really console them, or if they get confused or don't wake up, or if they keep vomiting and vomiting. And then another good tip-off would be if they get a fever and they then seem like they're getting better, and then suddenly they get a fever again and a nasty cough.
Okay.
All of those things are things to suggest that you need to be in touch with your doctor or that your kid's getting
So it's
sicker.
a bad sign if they get the
Yeah.
fever again. Okay.
Now, the other thing is particular for kids with asthma or chronic diseases or very young children. You'll want to be in touch with your doctor or nurse to find out if you should give your kid antiviral medicine.
I was going to ask you
Yes,
about the
yes.
Tamiflu
Question.
because we have heard some conflicting reports that Tamiflu is not effective with the H1N1 virus. Is that true? I mean, where do we stand with Tamiflu or with the
Tamiflu-
antivirus?
There are two kinds of antivirals
Okay.
you can use, and they're both very effective against H1N1.
Okay.
Around the world, there have been about 8 people who have reported to have a virus that's resistant to the
Okay.
oseltamivir, the
Okay.
Tamiflu, but that's not very many
No.
given
Right.
the hundreds of thousands and millions of people who will probably get it. So that stuff works.
Okay.
And if your doctor recommends that your child take it, then you should absolutely do that.
Okay. And is the medical community really gearing up for, volumes of people? I mean, I know how hard it is to get an appointment at my pediatrician's office anyway.
Right. Well, it's a really good question, and I'm glad you're asked, because I think everybody is gearing up in a big way. But just like if your kid had a mild illness, you probably wouldn't take them to the pediatrician anyway.
Yeah.
Probably most of this can be handled on the phone. And if you have concerns, call. You don't necessarily want to take a sick kid there and infect the rest of the office, nor do you want your kid or yourself to get infected by everybody who's there.
Right.
So use the phone as much as possible, and you can check with your doctor about how you get in touch with them. Most people have nurses who will call you back or whatever. If it gets really widespread in the community, chances are good that your health department will have a call center, and that if you have health insurance, that your health insurer will have a call center. And they all have nurse advice lines that you can call.
Okay.
What I would say is, in general, unless, your kid is very sick or you're really worried about these warning signs of deterioration, in general, the emergency room isn't the place to go. You're much better off going to your doctor's office or making a phone call.
So how do we, teach our kids to protect themselves from
We
this?
hear wash your hands, wash your hands, wash your
Is there
hands.
anything else?
And how many years have we been trying to get
I
our
know.
kids to wash their hands?
Right.
Again, I think we ought to take advantage in some sense of the opportunity to help our kids have all kinds of good health habits.
There are PSAs that Elmo has done, which are
Elmo.
Yeah,
We
isn't
love
it
Elmo.
great that Elmo is really into this too and
Yeah.
helping to take care of kids and families and teach everybody? It's actually really fun.
Well, Dr. Lurie, thank you so much for all of this wonderful information. We hope that the season is not as bad as what everybody thinks it's going to be. And I think if we all work together, we can really help.
Well, I think that that's exactly right. This really is something where we're all working together. And I think it's also important to just walk this fine line between taking this seriously, because people get sick and some people get very sick, and not panicking.
Right.
And that's a fine balance to walk, but I think if we're all in this together that we can do that.
Great. Thank you so much.
Okay, thank you.
For more information on how to keep your family safe and healthy through this flu season,
check out flu.gov and our website, mommycast.com.
Yes, and the first thing you have to do to stay healthy is always wash your hands.
Come on, wash your hands with Elmo. Wash, wash, wash.
Next, try to avoid touching your eyes, nose, and mouth.
Elmo's not touching.
And when you have to sneeze or cough, do it into the bend of your arm.
Sneeze into your arm with Elmo. Achoo!
Yeah, great job.